Beth, thank you for letting us share your video. So we've done some videos with Beth in the past. She looks so good. I have to brag on Beth's results. So this was her, so we did a lift, and we also did some sculpture and fillers, and we did upper eyelids. You can see that extra eyelid skin just settles down very nicely, looks very natural, but under the eyes where the crepiness you see, that's all sculpture. So sculpture is a tremendous treatment for under the eyes. We're going to do a little bit more sculpture today, and then of course the neck and jawline look really good. You can see the fullness in the jawline improved quite a bit. She's had her peel not too distant, not too far in the distant past. So sculpture through here, and you see on her profile, nice sharp profile, but we're going to strengthen the jawline just a little bit more. So we talked about, let's take a look in the mirror together. We talked about doing a little bit more in the jawline through here underneath. Now, when we did it in the jawline the last time, her concern was she didn't want to look too wide, which we don't look too wide. And so because we're going to build inferiorly down below so it doesn't bring us out, so we're going to go down here. And she wanted to build a little bit, we all have a little asymmetry to our chin and mouth, so we're going to build a little bit on this side, and then around the cheeks, and then in the temple, and just a little bit through here. Any other areas, Beth?
Nope, I think we're good.
Okay, so we're going to do a little cleanse on the skin. I like to use the Hiba cleanse and then the alcohol. Beth is definitely one of our A+ students looking for extra credit. She looks so good. She's doing things the right way. And of course, she's an amazing smiler, so we're just so lucky to have great patients like Beth. And Claudia has everything set up perfectly for me, makes it very easy. Thank you, Claudia. And Alex is doing our video today. So you want me to move the headdress a little forward, or does that feel comfortable for you?
Forward.
Yeah, okay, so press this and bring it forward. How does that feel? A little bit better?
That's good.
Lock that down, there we go. If you need to adjust, you let me know. So cleanse on the skin. For the physicians and students that are watching, very rare to get an infection with fillers, but we still do the Hiba cleanse and the alcohol swab. I do like to remove the earrings. I sometimes leave them in, but it is a little bit easier to take the earrings out, so thank you, Beth. A little bit of the numbing medicine. So you feel buzz, and then pinch on 3. 1, 2, 3, pinch. You feel small, medium, big pinch, not too bad?
Not too bad.
1, 2, 3, pinch. 1, 2, 3, pinch. All right, we'll pinch you. 1, 2, 3, pinch. Beth is tough. And just a little touch. 1, 2, 3, pinch.
Dr. Rich, Angela says, hi, doctor. What are you doing?
Angela, thank you for watching, and thank you all for sharing. We are on a mission, buzz and pinch, 1, 2, 3, pinch, to stop bad plastic surgery and help people make their best choices, 1, 2, 3, pinch. 1, 2, 3, pinch. I'm wearing my Friday suit today, 1, 2, 3, pinch. 1, 2, 3, pinch. My wife and kids are so embarrassed they will not be seen around me when I'm wearing my suit, but that's okay. That's one of my superpowers, is embarrassing my kids. I'm so good at it. I don't even have to try. It just comes naturally. It's just... So now that I've done the numbing, do you feel a little bit of a pinch here, Beth? Small,
Slight.
medium, big?
Very slight.
Little pinch here. Little pinch here. All right. So Claudia, can I have you just, Claudia? Fill that one little spot in you, please. Thank you. Perfect. Little pinch there. Little pinch here. All right.
Dr. Rich Arvis is asking, what is happening?
So we've done some numbing medicine. We're going to be doing some filler for Beth. Just a few select area. Beth looks so good. Our A+ student looking for extra credit, and we're just filling a few little areas to define the jawline. We're going to be using the Bellafill and the Sculptor, and we'll also be working under the eyes. This is an advanced injection technique, so this is not for beginners. Okay, I'll trade you, Claudia, if you can just come over to this side for me, please. Yeah, that's fine. You can let that other side go now. And you put one here. Right there, just like that. Thank you. So I like to start with the Sculptra. Claudia has it mixed for me, which is great. So once you find that little, it's like a little pore, and then I twist, twist, twist to advance the cannula. I'm going to turn your head just a little bit that way. So you feel a little pressure, a little pinch. I'm not in a hurry if you need a break. Pressure, pinch, pressure, pinch. There's a little bit of numbing medicine with the Sculptra. I'm right anterior to the inferior orbital rim. Doing okay, Beth?
Mm-hmm.
She's tough.
Dr. Rich, Sherry says she loves watching this.
Oh, thank you. Thank you for watching and sharing. We're helping people do things the right way, so thank you to Beth for allowing us to share her treatment. People are living a lot longer, a little pinch there. They're looking a lot better. Thank goodness for modern medicine. So I tell my patients it's going to feel a little bit numb and goofy under the eyes. Very good. You doing okay, Beth?
Good.
Get the thumbs up. There are no contraindications for the vaccine and the fillers in any of our treatments. We are recommending it to our patients. I'm wearing our 3M VersaFlow Papper for additional protection for our patients, even though I've had the vaccine. Okay, I'll trade places with you there, Claudia.
Mm-hmm.
Go ahead, and I'll let you mix the next one. Okay. For the physicians and students that are watching, when you make the little insertion point, if you get a little bleeding, you just hold pressure for 30 seconds, a minute or two, and then it goes away. Twist, twist, twist. Big deep breath in and out. Little pressure, little pinch. You doing okay, Beth?
Yep.
So I'm really right anterior to the orbital septum and inferior orbital rim. We never make things perfect. We make them as good as we can. We need to come back and do more later. That's better than going too far. But we will not overdo it. And if we're lucky, of course, aging keeps coming for us. Better than the alternative. Everything is looking good. You doing okay, Beth?
Yep.
And then one more time. Thank you. So we'll start with the Sculptor, then we'll finish with the Bellafill. So at this point, Beth should feel a little bit less. She might feel a little pinch here or there. You doing okay, Beth?
Yep.
Pressure pinch, not too bad?
Mm-hmm.
And I'm using my left hand to guide the process, massage, and also tap, which is a little bit of a distraction. Every little sensory distraction helps so that patients are comfortable. Very good. Yeah, I'll trade you mine. Thank you. So we keep it that simple. We like to follow our ABCs of plastic surgery. When you know the ABCs, you're going to make your best choices because you understand the bigger picture. A stands for area. There are 4 areas we address to improve the facial appearance. If we sag, we tighten. If we lose volume, we fill. Sun damage, wrinkles, and sunspots to the skin, we can polish and repair the skin. You doing okay, Beth?
Yep.
The 4th area is better than everything else. That's our behavior. Nothing looks as good as Mother Nature's free facelift when we smile. Beth is definitely a big smiler. And there it is. None of our treatments look as good as Mother Nature's free facelift. Everything's looking good. I'm going to do a little bit in the temple. It's very normal that as we get older we have a little hollowing in the temple. So we're just putting that volume back that was there before. Beth has a really cute picture of her and her daughter. And they're 23. That was so adorable. And you can see the volume change. So A for area, tightening volume, skin behavior. B of ABCs of plastic surgery stands for boundaries. What are the rules for good cosmetic treatments? Number 1, safety is always first. Number 2, you must look natural, little pinch. Number 3, we want to prevent future aging. We can't make things perfect. We're not God, we just do the best we can. If we need to come back another day and do more, it's better than going too far. So, safety first, you must look natural, let's prevent, and let's get as much improvement as possible. Now, C stands for combination treatments. If we want our best results, we combine. You combine tightening volume and skin for best overall results. Best results, no downtime, is lift or laser. Best results for best result with one treatment is lift or laser. Best result, no downtime, is filler. Filler does a great job, but it doesn't give us a lift. Lift, I get wonderful results, but I can do even better when I combine. So combination treatments always get the best result. And then D stands for different perspective. We never see ourselves the same way that other people see us. And if you look at Beth's from straight ahead here, I love how first of all, the volume of the cheeks is great. The temple, really nice improvement. You see there's a tiny bit of a hollow, but nice and full, so that looks good. So we're going to do the same on this side. Everything's looking good. You doing okay, Beth?
Yep.
Filling in the temple gives us a tiny, tiny bit of a volume brow lift, which is a good thing. And in addition to the twist technique to position the cannula and shiver technique to put a fine amount of filler over a large area, the hydrodissection, once you inject a little bit of the product and you massage, it will hydrodissect, it will elevate the skin to allow you to get better access to the area with subsequent passes of the cannula. You doing okay, Beth? It may feel a little goofy around the eyes when the eyes feel numb, and that's normal. You turn your head this way just a little bit. Yep, I'm loving what I'm seeing there. So now I'm going to do a little bit more of the sculpture in a bit, but I am going to do a little bit on the chin. Can I do some more? Yeah. Thank you. Perfect. So So it was this area she thought was a little bit lower, so I'm going to start with that. And your chin this way for me just a little bit. Just a touch. We never see ourselves the same way others do. Pressure pinch. Pressure pinch, pressure pinch. Two or 3/10 of a cc just to balance, and I'm going to massage that straight away. Mm-hmm. Hit this over a little bit. Little pressure pinch here. I always go back to the other side straight away, so that way you know the amounts that you need, and you're keeping your symmetry pretty equal. You get a little fresh alcohol strong too. Thank you. Thanks. We have an office in Tampa and the Villages, Florida. We're happy to set up a consultation or send us your picture. If you're interested in pricing, you can go to little pinch in there, sorry. Pinch, pinch, pinch. imagelift.com/pricing. You can put in your wish list or give us a call, 813-463-9245. We're happy to give you a plan. Download our books on Amazon. We guarantee we can make you look younger in the Smile prescription. And our seminars, once a week, we've got a seminar somewhere around Central Florida, which is a great opportunity to come out and meet our team and see some of our patients. I'm going to turn your head this way just a little bit. So when I'm treating the jawline, I like to do a little bit inferior and a little bit lateral to the angle of the mandible. We're just putting back that bone that we lose. As we age, we lose bone, we can even get a little bit shorter. And we're just putting that volume back. You doing okay, Beth?
Yep.
Try and make it easier than getting a tattoo or easier than going to the dentist's office. Pressure pinch. I like to start out with half a syringe, just to a little bit of numbing, make it feel comfortable, and then I'm also assessing the aesthetic and seeing, do I like it? Do I want to add a little more laterally or a little more superiorly? And then, of course, I must massage straight away. Immediately after I do the fillers, I tell patients, obviously, you don't want to taste the chocolate cake before it's done baking. You need to let the swelling settle down, then the collagen's going to build. And at 2 months is when we usually take some pictures. Sorry, a little pinch there. So a little bit of a pinch there. Sorry, numbing. Okay, very good. Everything's looking good. You feel big pinch, little pinch, not too bad there, Beth?
No, I think I'm good.
So, 1, 2, 3. I'll put this one on there. Thank you. Turn your head this way a little bit. So I'm massaging and contouring the jawline. I like what I see. And I'll just keep building there. So. Turn your head this way just a little bit. Everything's looking good. One little tenth of a cc at a time, making great, great progress. You turn your head this way a little bit, thank you. It makes a difference to know the anatomy, understand the proportions, and to know how the anatomy changes as we age is critically important. You'll go, doctors can spend thousands of dollars going to meetings to learn to do these things, or they can just do it for free by watching our Facebook. We give great tutorials, and we have the best patients.
Dr. Rich, Dora is asking, what are we doing today?
We're doing some filler to strengthen the jawline and then hollows under the eyes, stimulating collagen. Thank you. Okay, so I've got a little bit more of the Bellafill and a little more of the Sculptor, so I'm going to show Beth. Why don't you open your eyes for me? So I did a little under the chin. Do you think a little bit more under the chin or leave the chin be? How do you feel? You can put your glasses on if you see better with your glasses. Did you set your glasses down?
No, it's okay.
I can add a little more to the chin.
What do you think? Is it symmetrical?
Well, I think so, yes. I think that we all have some asymmetry, so,
I just know it was droopier on that side.
I've added a little more, so it's a little more full. Make a big smile for me, big smile. Notice when we smile how it changes the face, so I like it where it is. If you see a little area, I can add some, but we're in that range. You get to a range where...
I think it looks pretty good.
I like it. You get to a range where you may even see something, but others don't, because it falls under the social radar. So I like what I see here. I built a little in here. How does it look in the back of the jawline? I'm going to add just a little touch more there and a little touch more here.
Okay.
I didn't want to add too much more to the cheeks. I don't want you to feel too full. And I really like the temples as well. It's a tiny bit swollen here, and that's going to settle.
Don't want to chase the swelling. That's right. Okay, yeah. A little more on here. Whatever you have left over,
Very good.
I'll take it.
There you go. All right. And I like to keep patients informed so that way they see where we're treating. And there's no surprises. Let me have you rest your head all the way back.
Okay.
I'm going to turn your head this way just a little bit. Very important to maintain the balance and symmetry, which is definitely what we're going to do. And if Beth does not tell her family or friends what she's done, they're not going to figure it out.
They don't know.
And what tremendous results from her before and after. So proud.
Very select few.
Dr. Rich, Dora's asking, do they numb you first?
Yes.
Yes, we are using that numbing medicine. Thank goodness for lidocaine.
I'll answer that, yes.
Everything is looking good. Twist, twist, twist to advance the cannula to the correct position. Shiver technique for a very fine amount of filler over a large area. It takes a little bit of time to develop that shiver technique that you feel in control. Once you do, it really is so helpful. Just a little bit, not too much. We can always come back and do more. Patients will sometimes ask, they say, well, Bellafill, it lasts about 5 years. They did a 5-year study with Bellafill. Make sure you head this way. And that's what they say, the Bellafill lasts 5 years, but the study ends, the Bellafill doesn't. It keeps going. So the FDA approval says it is non-absorbable, and it definitely stays permanently. There's no way for the body to clear the product, so that is the most popular choice. The most expensive filler is the temporary, because we have to keep replacing it. And I like to mix in the Sculptra with the use of the Bellafill because it is a superior collagen stimulator. So the combination of the fillers makes for the artistry that you see. A little pressure, a little pinch here. Just a tiny bit in the fold here for balance. Patients may say they feel a little numb over their lip, and that's very normal. I like to recommend that 5-minute massage 5 times a day for 5 days. No real restrictions in the activities from what we've done. Little pressure pinch, sorry, little pinch. Very good. Thank you all for watching. Thank you for sharing. If you tell your friends that you were watching live treatments, they're going to be upset with you. You didn't share, so make sure you share.
Dr. Rich, Dora is asking, what does this procedure cost? Is there a downtime?
There's no downtime. The cost depends on what your goals and outcome are. How much treatment you do, how much filler. So it's better to have a treatment plan. Give us a call, 813-463-9245. Or you can go to imagelift.com/pricing. I'm going to do just a little touch here to make sure we're done. Pressure pinch, pressure pinch. Now the Sculptra, of course, goes away 100%, and then you'll see the collagen build up at around 3 to 6 weeks. And even at 2 months, 4 months, and 6 months, you see continued improvement. So it is a delayed gratification. And we're focusing on the little valleys that we see. Perfect. Pressure pinch, little pinch there. Okay, Beth. So we are completely done. You did great. Congratulations. So 5-minute massage, 5 times a day for 5 days. Beth is definitely going to pass the grocery store test today. She walks into the grocery, no one does a double take. Tiny, tiny bit swollen, but not that much really. Temples, cheeks, smile lines around the mouth, and back of the jaw. How does it look so far?
Looks good.
So we'll give her some ice. We're going to set her appointment. And I tell all my patients, give me a call if you need anything before your next follow-up. And one more time, we're going to look at the pictures before we sign off. So you see here's the after result. And then this is Beth after she did her lift and filler combination, the neck and jawline, but you can really see on her profile, the neck, she's done the lift in the past, much better jawline, no jowling, and the eyes, that Sculptra underneath, and we did a little blepharoplasty, and of course Sculptra under the eyes gets rid of those wrinkles all by itself, non-surgically under the eyes. So Thank you all for watching. Thank you, Beth. Hugs and hugs and hugs.
Air hugs.
Hugs for you. Thank you for watching. We're on a mission to stop bad plastic surgery. Thank you for sharing and helping other people know what their options are so we can do things the right way. I'm Dr. Rich Castellano. I'll see you in the next video. Great job, everybody.